On behalf of Cancer Control Alberta and Alberta Health Services, I'd like to thank you for viewing this video. I'm Jill Forsyth, the Director for Cancer Care Teams for Community Oncology South. We provide cancer care services in the cancer centres of Lethbridge, the Jack 80 Cancer Centre, Medicine Hat, the Marjorie E. Ewell Cancer Centre, Bow Valley, which is Canmore, Drumheller, and High River Community Cancer Centres. All community cancer center teams have the same knowledge and skills as those teams working in larger centers. We will support you and your family to ensure you receive high-quality, safe cancer care closer to home, eliminating the need for travel, added expense, additional time, and the inconvenience of trying to find a parking space. We hope this video will provide you with valuable information and will encourage you to speak with your medical oncologist to inquire whether you could receive your care and treatments at the community cancer center closest to your home. Thank you.
I know it's good for the people in Drumheller and this area. There's a lot of people come from Hatta, Youngstown, some from Stettler, some from Delburn and that area. They have enough time getting to here rather than go to Calgary, which adds on another 2 hours from here to go to Calgary in the wintertime. And when I got sick here with cancer, they said we were going to just do everything right here. All I had to do is go and see the oncologist in Calgary every 3 months or so. That was just perfect.
From the time I entered the door here and met Carissa's navigator who explained what was available, how they were going to do things and so forth, I was more than happy. In fact, I'd love to see it that I could take my 7 days here because certainly the travel would be less. And let's be honest, the demands on you are a hang of a lot less here too. We contributed, like many people did in High River, little knowing at the time that I was going to actually use the facility itself. So that's basically how I came to know it. Plus other people that I know in High River that have had to have chemotherapy, that took it here, that were singing the praises of the place.
I remember asking my doctor, is there any other place I can get treated? And he said, well, yes, as a matter of fact, you can go down to High River. They have treatment there. It was closer to home. I'm familiar with this hospital. I've always had really good experiences with it. It was like coming to your favorite aunt's house to have a treatment. Oh, everyone was so friendly and yet you felt so well cared for.
In Canmore, it's very quiet and peaceful, and lots of parking, and it's free, and so it's a pleasure to come here. It's a smaller area where the treatment takes place. It's got a beautiful view of the mountains. The people here are so friendly and professional, and I find it very relaxing. It increases our quality of life, I would say, because we spend a couple hours in Canmore as against a couple hours in the hospital in Calgary, and a couple hours driving one way and a couple of hours driving another way, and all the stress and hassle that goes with that.
My first visit here, they gave me a binder full of pictures of quilts and said choose a quilt. The quilting group here in Canmore make these quilts for all the patients, and that made me feel extremely loved by strangers.
I've been working for the Community Cancer Center in High River for a long time. I started about the year 2000. Having a community cancer center in your local area, I think, is such an advantage for patients, especially ones that live outside of a major center. I mean, even for High River, you know, to drive to the Tom Baker Cancer Center is an hour on a good day. And a lot of times it's more than that. And it's right through the center of the city through heavy traffic. And many people, when they're going through cancer treatment, the last thing they really need is to, struggle with that commute. So to have a cancer center in your own community or in a neighboring community just takes that pressure off the travel.
Given the fact that we're in a community of about 8,000 people, do they have enough doctors, nurses, treatment opportunities, options, and ideas here about how things go? That came very positively reinforced when I first came, and they said, here's what we can do, here's what we can't do. There's 3 doctors here, and I can't say enough positive things about them. They treated me extremely well when I was in emergency, even when I was in hospital. I was in hospital for 8 days. They came to see me on a regular basis. So did the girls from here, from the cancer center. They were constantly, making sure that I was well, seeing how I was doing. And when I was given the go-ahead to go back home, it was, well, we'll see you next week. There were always follow-ups with me to see how I was doing.
My name is Vanessa Krause. I'm a medical oncologist at the Tom Baker Cancer Centre. I'm also the medical liaison for the community cancer centres in southern Alberta, and I've served in that role for more than a decade now. So generally, when a patient is referred for medical oncology consultation, they would be seen first in Calgary at the Tom Baker Cancer Centre by a medical oncologist who would review their file and with them establish an overall treatment plan going forward. And then if it's appropriate, they might have that opportunity to receive that actual treatment plan at one of the community cancer centers closer to home for them. But if there were ever any questions or concerns about the ongoing care of that patient, they always have the ability to check back in with the medical oncologist back at the Tom Baker to make adjustments as required.
I did not want to do because I was so comfortable in Calgary and with the people there. I was scared to go anywhere else. My first impression here when I walked in, it's so beautiful. You walk into these wide open windows and the mountains. I immediately felt calm, happy, and they do everything in their power to help you.
We know that cancer and its treatment can affect many areas of patients' and family members' well-being: emotional, social, practical, and physical or functional. It's important to know that psychosocial and rehabilitation services are available for patients and family members to help improve well-being and quality of life. Some of these services may require travel to the major cancer centers to meet with specialists in person, such as physiotherapists, for example, but some services are available over the phone or through telehealth, such as social work. In-person psychosocial and rehabilitation services may also be available through your local hospital, community health center, or home care service. So it's a really great idea to talk to your healthcare provider to learn about the services available to you.
Technology has advanced over the last number of years, and so we actually have telehealth services available here. In one of our other rooms, we have you can do the full video conferencing service. So essentially, we can have remote access where a specialist might be able to actually see a patient. They can even do that with us in the room. We can examine and show the patient or show the specialist what's going on, and they don't have to, they can see the patient without having to travel down. And I can see x-rays that are done at the Foothills Hospital at the Tom Baker, and likewise the oncologist at the Tom Baker can see any of the x-rays or CT scans that are done at our hospital. They can pull them up and look at the actual images if they like. They get all the reports.
So my name is Dr. Catherine Hines, and I work at the Bow Valley Canmore Community Cancer Center. That navigator can see people like right from the very beginning, diagnosis. We make sure that every family physician in Canmore specifically and in Banff knows that when a patient's been diagnosed with cancer, they can put in a call to our navigator, and she will see them possibly even before they get seen by the oncologist at the Tom Baker. So people who are receiving radiotherapy or combination chemo radiation and are already being treated at our center can be seen by our navigator for support.
The owner of the navigator was very, very good at organising my wife's care. The compassion she showed with phone calls and the interest that she showed, it just makes my wife feel a lot better.
Everybody is so supportive of you here. Right down to the lady I was talking to in the waiting room when we go, she got a chance to ring the bell, which is done when things are clear. After all those years, they're clear. Everybody celebrates here. I've been in that waiting room and cheered along with everybody else when the bell was rung. It's a very fulfilling situation, let me tell you.
What was important was the fact that I was close to home and I was here with my neighbors and friends who were treating me. And plus the other fact was when I left here, this cancer center, outside here in my neighborhood, they were there. So they were part of my own support network, and that was extremely important to me. If I had to describe what was my experience here in Drumheller, home, peace of mind, well-being, those are my words.